Welcome to today's Lunch and Learn with Librarians. Today's session is Systematic Review and Evidence Synthesis Services. My name is Jackie Mays, and I will be moderating today's session. Before we start the presentation with Melissa, I will just want to mention that if you have questions, you can place them in the chat box, and that chat box is accessible by clicking the chat button at the bottom of your Zoom screen. We will also have a question and answer session, a live one at the end of the presentation today, and questions will be answered at that time. As we go along, we will post relevant links in the chat, so be on the lookout for those. And after this presentation today, we will email you the recording and slides. So you will receive those after today's Lunch and Learn. So from here, I'd like to introduce today's speaker, Melissa Pulis, who is an education, instruction, and outreach librarian at the Cleveland Health Sciences Library. Melissa will be speaking to us about the library's systematic reviews and evidence synthesis services. Welcome, Melissa.
Thanks, Jackie. Hi, everyone. My name is Melissa Pulis, and like Jackie said, I'm an education, instruction, and outreach librarian here at the Cleveland Health Sciences Library. So in today's Lunch and Learn, I'm going to tell you about our systematic review and evidence synthesis services that the library offers. So we've actually provided these services for years in an informal way, meaning that if you asked us for help, we would, but we didn't advertise it due to low staff capacity. But now we have a few more librarians on the team. We wanted to be more proactive in getting the word out about the service and how we can help you. So my presentation today will take about 15 minutes, and I'll be introducing you to our team, explaining the role of librarians in evidence synthesis projects, telling you about our services, showing you how you can set up a consultation for yourself, provide some helpful resources, and then at the end, we'll have some time for questions and then wrap up. So let me start by introducing you to the librarians on our Systematic Review and Evidence Synthesis Services team. I've already introduced myself, but we also have three other librarians, which are Vivian McCallum, Jackie Mays, and Tom Hayes, who is the leader of our Systematic Review service. Before we jump in, I just wanted to take a moment to define some terminology so that we're all on the same page when I'm using a certain language today. The term systematic review tends to be used as an umbrella term for every type of review, but that's not always the case. Yes, most reviews are done in a systematic way, but there's really only one type of review that's a systematic review. There's really 14 other types. So I wanted to clarify that during this presentation, when I use the term systematic review, I'm referring to the actual systematic review type. But with that said, we do also help with all of the other types of reviews, including scoping reviews, rapid reviews, mixed methods reviews, integrative reviews, and the most popular type of review that our students do, which is a literature review, also known as a narrative review. So let's just jump right in and start discussing the role that librarians play on the systematic review and evidence synthesis team. I'm hoping that all of you already know about the value we can bring, but if not, let me tell you more. So the bottom line is that librarians make reviews better. And if you know any librarians, you know that we're a humble bunch, and I wouldn't make such a bold claim if I didn't have some research to back me up. And so on the slide, I've put a sampling of some research that's out there so if you want to look it up, but you don't have to. I will summarize it for you. So first, the research shows that having a librarian involved leads to improved quality and reproducibility of your reviews. Next, librarians are expert searchers, so we know how to create comprehensive and unbiased search strategies. Third, having a librarian on the team can improve the efficiency of your project When the librarian does the search-related tasks on the review, that just frees the researchers up to spend their time on other tasks that need to be done, like screening, synthesis, analysis, and actually writing the review. And finally, librarians can ensure methodological rigor as we stay up to date on all of the best practices in conducting reviews. And I wanted to mention that several leading organizations that are listed here on this slide specifically recommend that researchers include a librarian or information professional on their review team. So what are the specific ways a librarian can help, or like what role does the librarian play in a review project? Some of you may have never worked with a librarian before, so you may be wondering that. And the answer is librarians can help at every stage in the review cycle. It's starting from prep and planning to protocol development and registration, selecting databases, developing, running, and translating searches, providing guidance on finding full text, managing citations, helping you to use Covidence or any other review tool like Librarian, and documenting the search strategy. So I hope at this point you're convinced of the value that librarians can bring to a review. So let's spend some time talking about the actual services that we provide. So who's eligible to take advantage of our systematic review and evidence synthesis services? We'll provide assistance to anyone that's affiliated with Case Western Reserve University. So that includes our faculty and clinicians, our staff, students at all levels from undergrad to doctoral level, and also residents at UH, VA, and Metro Health. So let's get to the elephant in the room, and that is, what is the cost of the service? And the answer is there is no cost. This is a free service that we provide to the Case Health Sciences community. However, with that said, we know that even free things have a price, and that is that we're only a team of 4 librarians. So depending on our workload, there may be time restrictions that impact our services and our response time. But knowing this, we will discuss this with you when you first meet with us and find out what your expected timeline is. If that's something that's not feasible for us, we'll let you know right away before we commit to the project or before we begin any work. We view this as a partnership, so communication is key, and we're always transparent and realistic about our capacity. As far as our involvement goes, we can be involved as little or as much as you need, and we can negotiate the specifics when we first meet. But in general, our support typically falls into 3 different levels of engagement. That would be low, which is us providing educational support to you, medium, which is where we provide a consultation, and then high, where we're a member of the review team. So let's take a deeper look into each one of these levels. So at the lowest level, we'll teach you how to do a review, but you will do the work. This is primarily how we help students because ethically, we can't perform any work when there's a graded assignment involved. So we'll teach the student how to do the review, do the search, or refine their search question, whatever they need. And then hopefully they'll, have enough to go ahead and move forward with their project. The support is typically given in a 1-hour Zoom or an in-person meeting. But so yeah, we'll provide this to any student or anyone that wants to learn. We can teach you. Now, if you need more involvement, we can also provide more hands-on and in-depth assistance in a consultation. So in this stage, you're still doing the work, but we just function as kind of an expert advisor. A consult is best for faculty, residents, clinicians, and researchers. And we typically spend about 1 to 6 hours on these. And some typical ways we help in consultations are providing expert search assistance, performing a peer review or a critique of an existing search strategy, teaching how to use specific databases, and advising on best practices. At the highest level of support, we actually become a member of the team and contribute to the work of the review. And since we're doing the work at this level, it's not appropriate for students because again, we can't do any work when there's a graded assignment involved. But we welcome requests from faculty, residents, and other researchers. So this is typically a huge time commitment from us, at least 10 hours. So we do require that you have a protocol registered before we begin the work. We just want to make sure that you've thought the review through and this is a serious project, which I know sounds a little bit harsh, but as you can imagine, a lot of reviews get started and then get abandoned because everybody underestimated the amount of work that needs to be done. But at the end of the day, we just want our work to be meaningful and your project to be successful. So as part of the team, we also require co-authorship or acknowledgement depending on the level of work that we provide to the review. And as for the work we do as the team member, we can create, run, and translate the searches across databases, document the search strategy, assist in finding full text, and write the search methodology. So hopefully at this point, you're wondering how you can take advantage of the service and request a consultation with us. And so the good news is it's very easy. All you need to do is go to our website, which is at case.edu/CHS library, and then submit the literature or systematic review consultation request form that's highlighted in red here on the screenshot. Jackie will share the link to our website in the chat box right now. You can also just email us directly at askchsl@case.edu, and that will get the conversation going. So for those of you that are intrigued but not quite ready for a consultation, we do have some helpful resources that you can peruse at your leisure to learn more about our services or to learn more about systematic reviews. And the first is our systematic review guide on our website. And so this guide goes over every step of the systematic review process, and it also outlines the service that I went over with you today. I have a QR code on the slide and the URL, but Jackie will share the link to this as well. Now, another resource I want to share that I hope you're already familiar with is the library's website. So the URL to our website is case.edu/CHS library. And when you go to our website, I've highlighted some areas that will be helpful for you when you're doing a review yourself, which would be underneath the picture of our library. I want to point out that is where you access our library catalog, the journals we subscribe to, and all of the databases that we offer. On the right-hand side, I've already mentioned how you can use that form to request a service, or there's also a calendar where you can make a direct appointment on the right-hand navigation. And finally, we have more research guides like the systematic review guide that I just showed in the previous slide that you can browse if you want to learn more about any topic. And last, I want to share our Covidence guide. And for those of you that don't know, the librarian has an institutional license to Covidence, which is an amazing online project management tool for reviews. So anyone with a case email address can create an account with full access under our license. This guide here that I'm sharing with you in this slide will tell you how to create an account and how to use Covidence in your review. So that wraps up my formal presentation today. And we have some time for questions. So if anybody has anything, I'm here to answer them.
Thank you, Melissa. That was some excellent information on systematic reviews and the library's systematic review service. So like you just said, we do have time for questions. I also put all of those links into the chat box for requesting a consultation, our email address, and then those resources as well, Systematic Review Guide, library website, and the Covenants Guide. So thank you for all of that. So if anyone has any questions, we'll take just a minute or so here and we can answer those.
Doesn't look like there's any questions, and that's okay.
Yeah.
If you do afterwards, if you realize you have a question, we gave you the contact information. Just reach out. We'll be happy to answer any questions that you have. But otherwise, this wraps up our presentation today. I want to thank everybody for coming and letting me tell you a little bit more about our services. So again, if you have any questions, please reach out to us. I have my email address here. It's just email us at askchsl@case.edu. And I hope we can work with you all in the future. Thank you.